Hey everybody, sorry it's been a while. Whoops, it was summer and there was a lot of stuff going on here, so I really kind of dropped off there for a minute, but I'm back. I'm still here and I'm actually participating in a telehealth challenge. So I've been trying to reach folks that have wounds and are struggling and either helping clinicians with their clients or with the clients directly. So feel free if you're having any wound issues to reach out. But it is Telehealth Tuesday, so I thought I would come on here and talk a little bit about um, two wounds that I saw pictures on this week and was trying to help. So um, I'm going to try to post the pictures in this group. I might have to wait until I'm done chatting with you all, but let's see if I can do two things at once. Sometimes I'm good at that, sometimes I'm not. Can't. Let me scroll. Oh, hold on. Let me see. I'm going to try and post those pictures now. I'm going to try to. Oops. You can hear me? That's weird. Yep. All right. I'm going to have to do it when I'm done. So anyway, so the first one was actually a tummy tuck that what happened about a year ago, and there were two small openings that were still present. So one of the wounds had some sloughy stuff in it, and that looked like that needed to be cleaned up. And then the other little site looked like there was some underlying structures, but the whole thing, like none of it looked pink, red, and viable. It all looked very pale. What we refer to as a pivoli, so the edges were kind of rolling in, and it's not going to heal. So basically, she had consulted with two docs, and they were planning. One wanted to do a revision, like open her up and close her back up again, suture her up, and the other one wanted to open it up and then put it back on it. And so she was just kind of looking for some advice on that. And honestly, really either option could work. We never really know. The one doctor that was planning to go in and reopen her up might wind up, when she got in there, deciding to put her back on it. So we never really know. I'm not sure what she's going to choose, but either option would have worked. But both of those wounds, there was no viable red tissue. There was not even really much slough. So it was definitely going to need a surgical revision either way. However they chose to close it, would be however it worked out. So that just kind of got me thinking about all of you. I'm in some groups, and I see a lot of folks kind of struggling with their incisions closing. Sometimes they're left with the one line. The line is most of it's good, and then like a section kind of just won't cooperate, and they're kind of left in limbo, and this one little wound won't heal. So some of my advice for you guys in kind of preventing that scenario from happening to you is to get ahead of it. Like waiting a year to change treatment or get another opinion, it's probably going to leave you in a similar situation as this poor woman in needing to have a surgical revision. But if your doctor is recommending that you pack it with gauze and wait and see and let it go for months and months and months, we definitely can do better than that. Gauze tends to cause chronic wounds, and that's what she's dealing with, and that's what I see a lot of you folks dealing with. And a lot of you are going online and kind of looking for places on Facebook, and some of the recommendations are pretty good and some aren't so great. So if you're struggling, you don't know what to do, I'm here as a resource. I am a doctor of physical therapy and a certified wound specialist, and I do consultations. I also help clinicians with their clients and clients directly. So feel free to reach out. That's what Telehealth Tuesday is all about. Me trying to help you and give you advice and help you get that wound closed. So if you shouldn't really be waiting more than a couple of weeks to get either another recommendation or another consultation, something. If you've got a wound that's open and it's not progressing, it's no longer looking pink, red, viable, beefy, healthy, we've got a lot of things that we can do to help you. And actually, one of the things you can do to help yourself is if you're smoking, stop smoking. You're not helping. If you're using gauze, we can switch that. If you have any underlying issues like diabetes, we absolutely need to get that blood sugar under control because that wound may never close with those kind of factors in play. And what else? Definitely nutrition, making sure you're getting in enough protein and enough water, and you're getting your vitamins, and you're eating clean and healthy, getting exercise. All that's going to help. And exercise, I mean, just kind of not sitting around and being a couch potato, but going for walks and things like that. All really help to heal the skin. So if you have any questions, please feel free to reach out on that. And then the other picture that I saw, which I will post as soon as I can, was more of a lower extremity. It looked like, I'm not really sure how it was caused, but it was a wound that had been open for a while, and it was progressing, but it just wasn't closing. And in the image, you'll see that there was some significant swelling around the area, and I'm not sure, I wasn't there exactly, but it could have been like lymphedema or venous insufficiency or a combination of the two, where they just had some chronic edema issues. So a lot of the recommendations that were coming across for this person was to add compression garments in. And we're not talking about like the TED hose, the post-surgical garments. We're talking about actual compression garments. They can be difficult to put on, so you usually want to get them and get a recommendation from a clinician. I know several lymphedema therapists, so if you are feeling like maybe that's you, or you're not a lymphedema therapist and you need help and advice, I have plenty of people that I can put you in touch with, so feel free to reach out with that. And then, so that, we were recommending, and that also got me thinking, like, okay, what can we do? What could a clinician who's not wound certified, who doesn't know lymphedema, what could they do if they see one of their clients coming in, they have a wound, they have edema, how do they help their clinician? Well, first of all, you can, ask for a consultation. We'll put you in touch with somebody, but we also need to encourage movement, right? In order to stimulate the lymphatic system, they need to be moving. So deep breathing is really important, kind of filling in that gut, getting that breath down in there will help to stimulate the lymphatic system, and also moving. So if this patient, though, I just got the impression that they were sitting a lot. So let's say this is someone that is not very mobile. You want to be encouraging lots of pumping activities. So, things like they're pumping their toes, they're doing pumping motions up at the hip, lymphatic drainage. If they're sitting a lot, we've got lymph nodes in the back of our knee, we've got lymph nodes in the inguinal area. We need to get these people up and moving. So if you're having a client like that and their mobility is really a factor, we absolutely need to be referring to physical therapy and getting them moving and grooving again. So super, super important. So again, like encouraging tapping, manual lymph drainage is fantastic. And that's not even talking about the wound care. Compression, garments, all super important for folks. There's so much that we can do to help people with wounds. I'll go ahead and post the pics below, but if anyone has any wounds that they're struggling with, they're looking for advice or just like a direction, anything, I'm more than happy to help. So feel free to reach out. Telehealth Tuesday. I'm Heather Flexer. This is Better Wounds. Thanks for joining. Bye.